Welcome back, everybody. 7 Minutes for Seniors. I am Chris Wilson with Modified Independence, and I am here for the second day in a row wearing the same clothes with Lucie Browder. We are coming to you from Benton House in Oakleaf. Today is our second segment. So thank you for being here. Let's jump right in. I got my questions on the floor, by the
Love
way,
it.
if you can't see them. So how exactly does mobile medical help seniors?
Yeah. So there are a few highlights. I could take way more than 7 minutes. Um, so, as you know, a lot of seniors don't have access to the care.
Mhm.
They can't get there. They don't have transportation. They can't drive. Um, and a lot don't know about everything that could be
Mhm.
specifically for them. So, what we do is we come into their homes and have their traditional primary care visit there.
Mhm.
What that would include would be reviewing their medications, identifying if there are refills that are needed, if there are recommendations for medication
Mhm.
updates. We can help with lab work.
Mhm.
The phlebotomist comes to their home to help them with their lab work. Let's say that they need some type of a simple x-ray.
Mhm.
We actually coordinate with x-ray companies that come into homes and into senior living communities to do those tests. So what that does is helps reduce ER visits,
Mhm.
hospitalizations,
Yep.
and kind of helps them and their loved ones be more aware of the care that's going on and the care that they need.
Mhm.
Um, we also help order things like physical therapy, occupational therapy, home evaluations for safety,
Yeah.
and then the equipment that's recommended,
Yep.
through those types of modalities and treatments. Um, if someone bumps their arm and needs some type of a nurse to come out to their home, we can order that as
Mhm.
well and oversee those types of therapies. And then we help connect them with other resources,
Mhm.
even other specialists in the area if they're needing cardiac,
Mhm.
they're needing renal, if they're needing, you know, any other types of specialties. They
Right.
can help with all of those. We don't have an affiliation with any particular hospital, so they're free to have their
Yep.
care at any of those. And then we have a team that follows up when they're in the hospital or when they go to short term rehab.
Mhm.
When our folks get home, or maybe they've already been home and they realize they need a little bit more of intensive therapy and
Mhm.
rehab, we have resources for that as well.
Get them involved.
Yeah.
Yeah.
And then when we have our folks for that have joint pain, knees, back, shoulders, elbows, we have providers that specialize in treatment for that in their
The
home.
pain management, the pain
Yep.
management component,
Yep.
because your typical primary provider can't do the pain medicine, right? It has to be a separate visit with separate criteria, correct?
It is a separate
Yeah.
visit. It may be the same
Okay.
provider,
But
yep,
it's
but
just
they are
yeah.
different visits.
Yeah.
And then for our folks that need the behavioral health piece, we have nurse practitioners that are specific for behavioral health.
Mm.
They can help with medication management for that. We have behavioral health for talk therapy as well.
Mm.
And then going back to the nurse practitioner for behavioral health, they help with not only disorders such as depression and those kinds of things, but also adjustment disorders.
Okay.
There's lots of changes when
Mhm.
you're a senior. It's really hard sometimes to get a hold of everything that's happening.
Yeah.
And so that really affects some folks. So they really work with them. And we really are just wanting to ensure that folks are aware that this is a service that your insurance typically will cover.
Is there a homebound requirement?
Overall, the service is done in their home.
Mhm.
We do have folks that will still drive,
Hmm.
but it's not the same as a traditional home health care.
Okay, so there isn't a homebound requirement.
Right, it's a
And
little
that
bit
and I
different.
asked that on purpose because I like to highlight the fact that a lot of times when we refer you guys, it's because we see a caregiver with their hair falling out because they've
Right.
been taking care of the homebound person, and
Mhm.
we know that caregivers miss up to 6 years of appointments while they're caring for somebody,
Right.
and those years are very critical because those are the advancing years and everything like
Mhm.
that, and we don't need people missing those appointments. So a lot of times we're referring you because we can refer you to the person who's laying in the hospital bed, but we really want you to see that spouse
Right.
who's not getting taken care of,
Exactly.
and not having a homebound requirement is very important to that,
Yeah.
because obviously if you got a tiny little wife and a big old husband and
Yeah.
she's trying to take him to a doctor's appointment, it's really difficult,
Yeah.
so if
Well,
your providers can come in, it's a lot easier.
yeah, and a lot of times we will come in to take care of that husband, and then the wife says, "Oh, I think I would like to sign up with you as well," just so that they can both get that treatment and that ease of her leaving him while
Yeah,
she's at her appointment, is removed.
yeah, not having to worry about having some sort of caregiver
Exactly.
or respite care or something,
Hmm.
because that just adds to the cost of taking care of somebody, right?
Absolutely.
So now, who's your ideal client?
So our ideal client is going to be that adult who cannot get to their doctor easily, who is looking for more resources in their home. In our assisted living communities, for example, there are often medication needs and labs. UTIs, for example,
Yeah.
are a really common um, thing that comes up. And sorry, it's distracting.
No, it's on purpose. We don't want to run
I
over
know,
too
I'm
long.
like, oh.
No, keep going.
And so with us being there, we want to be able to get them that test to see if that's what's happening, that's what's causing the confusion,
Yeah.
to be able to get the medication ordered. Um, and so typically it's going to be your adult that needs care, whether it's short term or long term.
Hmm.
We do have some folks that are in our lovely state,
Hmm.
since we are throughout the whole state,
Yeah.
that are here for a season.
Snowbirds.
Yep. And so they are needing care while they're here.
Hmm.
And so we can provide that care even temporarily.
And that's awesome. And then they
Mhm.
can get those records and take them back with them
Absolutely.
back to Michigan or Maine or
Yep.
whatever snowy, terrible place they live in.
Keep me in Florida.
Like I said, I don't have to shovel the heat.
No,
That's it.
I'm going to start saying that too.
Well, that's been our second segment of 7 Minutes for Seniors. I'm Chris. This is Lucie. It's been a pleasure. Y'all have a great day and be safe. Thank you.